Good afternoon, everyone. I want to thank you for joining as we update where we are in our fight against COVID-19. As of today, North Carolina has 3,651 confirmed cases, and sadly, our death count now stands at 65 people. I know as we approach a holiday weekend that this loss of life will be even more profound for many, and we're thinking about their families and their friends. As I previewed earlier in the week, today I'm signing a new executive order that does three important things. First, this order requires new social distancing policies at retail stores that are open. This should make shopping safer for customers and retail employees and help prevent stores from becoming flashpoints for virus transmission. Effective Monday at 5 p.m., stores may not have a number of people inside at one time that is more than 20% of the stated fire capacity, or either 5 people for every 1,000 square feet. The stores must also mark 6 feet of distance at places where people need to gather, like at checkout lines, and they must perform frequent environmental cleaning and routine disinfection. Even as we follow the stay-at-home order, there are still essential reasons to leave the house, like for groceries or medicine. And we want to ensure that retail stores are as safe as possible for everyone so that no one is afraid to go out for basic necessities. The order also encourages stores to make hand sanitizer accessible, to set shopping times for seniors and at-risk people, to use shields at checkout, and to mark aisles as one way to limit traffic. Now, I know a number of stores have already taken steps like these and more to keep their customers and employees safe, and I thank them for their efforts. The second part of this order includes mandatory protective measures for nursing homes that had previously been recommended just as guidance. It prevents dining and group activities in common spaces. It requires face masks for employees. And it also requires nursing homes to screen employees and residents for symptoms of sickness. We strongly encourage other long-term facilities to follow the same guidance. We're focusing efforts on these congregate care institutions since the nature of the virus makes them easy targets for outbreaks. The third part of this order requires additional measures that will get more unemployment claims processed faster. The order makes it easier for employers to file a batch of claims on behalf of their employees. This is known as an attached claim. By temporarily eliminating some of the hurdles for these employers, we hope to get benefits in the hands of those who need them faster. Since March 16th, the Division of Employment Security has accepted 497,000 unemployment claims. So far, the state has sent $40.3 million to North Carolinians, and more is going out every day. The department also has received updated guidance from the federal government on how to disperse the supplemental $600 a week benefit. Those payments are expected to begin by the end of next week. Time is critical and precious for those who are out of work. I, my staff, and the Secretary of Commerce are pushing the department to move as fast as possible. Every claim is important and represents an unemployed worker on the edge. Their families and our economy need these funds as quickly as possible. Now, with Easter coming up this weekend and Passover already underway, I want to remind everyone that now is not the time to take a chance by gathering with extended family or friends. Even though you're following the stay-at-home order and your relatives are too, it's still too risky to gather in groups for the holiday or any other reason for that matter. It's been strange not being in the church building on Sundays and it will be even harder not to be in the pew on Easter Sunday. But it's the right thing to do if we care about each other. I want to thank our places of worship for holding services online or encouraging their congregations to worship at home. You are protecting your members and everyone in the community by making these changes. I thank those of you who had planned trips to the coast or to the mountains, but now you're staying home. I know all this is hard, especially with some family traditions that have gone on for generations. This year's holidays will look a little different for all of us, but now is the time to hold fast to our beliefs and find new and meaningful ways to celebrate these holidays while staying at home. And we know that when we make these sacrifices now, we put our state one day closer to coming out of this pandemic, saving as many lives as possible. With me today is our Secretary of Health and Human Services, Dr. Mandy Cohen, our Secretary of Public Safety, Eric Hooks, and our Director of Emergency Management, Mike Sprayberry. Monica McGee and Cameron Larson are providing American Sign Language, and behind the scenes, Jackie and Jasmine Mativier are our Spanish language interpreters. Dr. Cohen, I'll recognize you first.
Thank you, Governor, and thanks to all of you. Staying at home doesn't sound like hard work, but we all know it is. So many North Carolinians are making real sacrifices on behalf of our families and our communities and our state. I know Governor Cooper will do everything he can to soften the impact and to work with our congressional delegation and the General Assembly so we all recover from this together. Our sacrifices are not in vain. We still have a long way to go, but together we are accomplishing what we set out to do. We are slowing the spread of this virus so fewer people get sick at the same time, and our hospitals are there for those who need care. We're doing this. You are doing this. We are coming together and creating a powerful response to COVID-19. And as the governor said, with Easter approaching and Passover underway, our resolve will be tested. Our traditions are steeped in being together. This year, though, the best way we can show our love for our friends and our family is to find new ways to be together. That's what I did last night for our family's celebration of Passover. We had 4 states represented at our virtual celebration: Pennsylvania, New York, Florida, North Carolina, and everyone from my 2-year-old nephew to my uncle in his 70s was on the screen. And miraculously, everyone figured out the technology. We laughed, we ate, we all tried to talk at the same time, but we felt connected despite our distance. And it's my sincere hope that all who celebrate this week have a meaningful holiday. We cannot let up on our efforts to stay home. Staying home saves lives. I also want to take this moment to call out the tremendous work of our public health leaders. It's National Public Health Week. There may be a spotlight now on their instrumental work that public health does because of COVID-19, but these local and state teams work day in and day out to make our communities healthier and safer, and I want to thank them personally for all that they do.
Thank you, Dr. Cohen. We'll now recognize our Director of Emergency Management, Mike Sprayberry. Mike.
Thank you, Governor, and thank you for your leadership. Good afternoon, everyone. The State Emergency Operations Center has now been activated for 31 days for the COVID-19 response. Our public health partners have been working even longer. 67 counties have activated their local emergency operations centers. Local public health and government officials, first responders, and emergency managers are working long hours every day in your community to keep you safe, and we all owe them our appreciation and a huge thank you. The pursuit of personal protective equipment for our medical facilities and first responders remains very difficult, but our teams are working hard to source and buy. Today, our logistics team pushed out shipments of masks, hand sanitizer, bleach, and gloves. We'll continue to push supplies out to where they're needed as quickly as we can get them in. I want to talk today about a few personal resources for people during this difficult time. The Hope for NC Helpline is available for people who need help coping and maintaining resilience during the pandemic. This free service is now available throughout the entire state and can help connect people to available mental health help by calling 855-587-3463. That's 855-587-3463 to get available mental health care. People are available 24/7 to take your call. And for our healthcare professionals, first responders, and other health workers who are experiencing stress on the front lines, there's the Hope for Healers Helpline. The North Carolina Psychological Foundation is providing 24/7 support. Just call 919-226-2002 and a licensed mental health professional will follow up with you. That number again is 919-226-2002 for the Hope for Healers Helpline. We talked about the food banks yesterday, and many of you answered the call to donate. Thank you for that. Food banks still need your help because many out-of-work people are relying on food banks for groceries right now. Please consider a financial contribution or a donation of shelf-stable foods to your local food bank. Visit feedingthecarolinas.org to find the website of a food bank near you. Again, that's feedingthecarolinas.org. You can give online. And remember, a trip to the food bank to get or give food is not considered a violation of the stay-at-home order. North Carolina 211 continues to be the front door for people who need information and help with food, utilities, child care, and many other needs. Thousands of calls are coming in daily, and sometimes they're busy. If you do call 211 and get a busy signal, simply wait a while and try your call again. For twice daily information updates on coronavirus, you don't have to call. I've always said it, just text COVID-NC to 898-211, and you can get text in English or Spanish. Don't forget to call your loved ones daily. Look out for your friends and neighbors and be kind. With your help, we will get through this together as one team, one mission, one family. Thank you. And thank you, Governor.
Thank you, Mike. We'll take questions from the media now. If you can identify yourself and your station or paper, we would appreciate it. We'll have our first question.
You have a question?
Yes, this is Taft Wireback with the Greensboro News and Record. Guilford County has a residential care facility with an ongoing outbreak. Are residential care facilities held to the same COVID-19 response standards as skilled nursing homes? And are they required to disclose the existence of an ongoing outbreak to the residents, the families of residents, and new or prospective residents who will be moving into the facility in the midst of an ongoing outbreak? Thanks.
Yeah, we know that transmission of a virus in a nursing home or skilled nursing facility can pass very quickly among the residents. And we need to take a lot of preventive measures to try to prevent virus from being introduced into these kinds of settings. And when we do find it, we have to take quick action. And this executive order is designed to help deal with all of that. But I'll let Dr. Cohen talk a little bit about the requirements that you talked about. Dr. Cohen.
Thank you, Governor. As you likely know, we limited visitation for all kinds of long-term care facilities a number of weeks back. So that applies to all. So no visitation except in the case of an end-of-life issue. For this new executive order, the stepped-up preventative measures and the recommendations are directed at skilled nursing facilities. So these are nursing homes that these recommendations are required for. They are requirements about, as the governor mentioned in his opening remarks, things like closing communal spaces, using face masks, and making sure that they're checking their employees daily as well as the residents daily. And specifically, we're targeting nursing homes. Obviously, these are the folks who are the most medically frail of those living in our long-term care settings. We know there are other settings like adult care homes, assisted living, and we want them as much as possible to follow these same recommendations, but they are not required at this time. Again, we want to make sure they're following as much as possible to do as much preventive work as we possibly can, but the requirements in the executive order are targeted for our skilled nursing facilities.
Next question, please.
Travis Fain, WRAL.
This is Travis Fain at WRAL. Thank you, Governor. I wanted to know specifically, do you have plans to try to release people early from state prisons, particularly older offenders? Is anything in the works on that, whether it be a commuted sentence? I know you've talked about looking at those options, but can you tell us how far along any of those plans are, please?
The safety of our correction staff, the safety of inmates are extremely important, as is the safety of the public. All of those have to be considered when making those kinds of decisions. The Department of Public Safety has already taken numerous actions to protect people in our prisons, and they are currently looking at all of the options to make things even safer there while balancing it with the safety of the public. And I'll let Secretary Eric Hooks talk a little bit about where they are in this process. Secretary Hooks.
Yes, sir. Thank you, Governor. Thank you for the question as well. Just as the Governor has stated, the department has long since been involved in looking at a variety of protective measures for both the staff and for our inmate population. We have been looking at a variety of mitigation strategies, and that also includes looking at those who are eligible for release. In North Carolina, over the last few years, we average approximately over 20,000 release of inmates a year. That process is ongoing, and we're looking at innovative ways that we can utilize the authorities that were within the department to do more.
Thank you, Eric. Next question, please.
Garrett Bergquist, Spectrum News.
Good afternoon, Governor. Garrett Bergquist with Spectrum News. Returning to the skilled nursing facility issue for a minute, the first real big outbreak we saw on U.S. soil, of course, was the one in Washington State. And, of course, now we're seeing it here. I guess my question is, if we saw that this was going to be an issue, why did we wait until now to issue these new guidelines to nursing facilities?
Well, first, we had already issued orders restricting visitation, which was the most important thing and a very difficult thing for these long-term skilled nursing facilities, nursing homes. When you get separated from family and they can't come in to visit you, that's a pretty big deal. But we did that in order to prevent as much as possible the virus from being introduced into these facilities. And we also gave them guidance in all of these other areas. But with this outbreak that we saw, we decided to go ahead and make this guidance mandatory to build up and to increase the protections that we have for our long-term care community. When they find someone who is positive, then they've got to isolate them and to treat them with separate staff that deal solely with COVID-19 patients. These kinds of protections are important, and we believe that it was important to make these additional recommendations that we had made mandatory because of what we had seen. You have anything to add to that, Dr. Cohen? Okay. Next question, please.
Colleen Quigley, WNCN.
Hey, good afternoon, Governor. I have a question regarding playgrounds and parks. We've seen so many people recently heading to these. We know that they're allowed to get fresh air and exercise, but would you consider an executive order closing down things like tennis courts or volleyball courts or places where people play? Because we do still see groups of people gathering at those.
Thank you for that question. There are a number of local governments that have closed some of these facilities, and a number of state parks have closed in the areas where the local governments have closed these facilities. We do want people to get exercise, but we want them to get it physically distanced from other people. So games like basketball and others where there is close contact, we don't want people to do that. All of the options continue to be on the table for executive orders, but we want people to have common sense about this. We want them to be outside and exercising, but it is really important for people to be 6 feet away from each other because this virus moves so fast in the population, and when people are gathered closely together, we've seen so many instances where many people in the group contract this virus. So those options are on the table. Some have already been closed. We want people to use their common sense, get the exercise, but stay apart from each other. Don't park in one place and gather around because that causes transmission of the virus, and we really don't want people to do that, and we're going to continue to emphasize that. Thanks a lot. Next question, please.
Mitch Weiss, Associated Press.
Yes, hi. I'm working cluster in Rutherford County, and we're told that 28 of the 31 people who have tested positive for COVID-19 in Rutherford County are members of the Word of Faith Fellowship Church. One church member died on Wednesday. Many members of the church live in communal housing, work at businesses together, and attend frequent functions, including services. My question is, what is being done to contain this cluster?
Well, first, our hearts go out to people who have contracted this virus and people who have died from it. It's a very cruel disease because often people can't be with their loved ones when they're having to go through this and can't even be with them at their death, which is torturous for families. And I certainly understand people of faith wanting to be together. I'm a person of faith myself and love being in community with my church. But it is so important right now to have services virtually or telling people to worship themselves in their home so that we don't contract this virus. And the order states clearly that public gatherings of more than 10 people are illegal now. And the reason for that is because it is so dangerous. And it applies to all of these gatherings, including church services. So we want people of faith to abide by this. My remarks earlier, and I have met with faith leaders virtually. We had a conference of about 800 faith leaders across the state to talk about this. There are many ministers out there right now telling other ministers how important it is as we approach Easter Sunday, one of the most important holidays we have for people of the Christian faith. It's so important to have these services virtually and to have people worshiping in their home instead of coming together physically. We've got to care for each other. We've got to be kind to each other. And if you are gathered like that, the chance of spreading this virus is too great. So we're strongly encouraging, and the order says that you're not supposed to publicly gather like that, and we hope that people will obey this order this weekend. But still worship and doing it virtually is a great way to do it. Thanks. Next question.
Steve Wiseman, News and Observer.
Hi, Governor. I have a question about nursing home, these outbreaks we're having there, and it seems like there's some inconsistencies or trouble with concerns, I guess, with how these are being reported from the facilities to the county to the state level, and then how they're being addressed. I know yesterday Orange County officials told us that they only found out about 60 cases in their county when you made the announcement. So do you feel like you maybe need to issue another order to make this more controlled or more transparent? And do you feel like the public is being protected at this point?
Dr. Cohen, I'll let you address that. But it's very important that we get this information out to the public so steps can be taken. And I know that our communication before all of this had been more decentralized. Since this pandemic has occurred, we've worked very hard to centralize our communication and coordinate them. But I'll let Dr. Cohen address that specifically.
Yes, for quite some time, we've had rules around having facilities report to our local health departments when they're having an outbreak of many different kinds, whether it was a flu outbreak or something related to a GI bug. So this is no different in COVID-19. So there's been a longstanding relationship between facilities and their local health departments. And in this case, in Orange County, the Orange County Health Department was very involved in that response, as well as helping them think through the infection control measures. I'm so appreciative of all of our local health departments. They are responding to these various outbreaks. And again, an outbreak is 2 or more cases. And then the local health department is really helping them to understand the proper infection control procedures. We at the state obviously want to continue to support that, help folks understand the guidance. And again, as this has been a rapidly evolving situation, we have put out new guidance and new ways of reporting and making sure we're all sharing good information. We know things are moving incredibly quickly, and these facilities are trying to deal with sick folks while also communicating. We know a lot's going on, and folks can be overwhelmed. We're so appreciative of the hard work going on to take care of some of our most vulnerable. We know that the reporting is really important as we all stay in good communication here. We did put as part of the executive order, again, that requirement to report to us. It was really already there as part of other outbreak, as I mentioned, but to reinforce the importance of that reporting and communication. Thank you.
Thank you, Dr. Cohen. Next question, please. Please. Dr. Cohen, I'll let you take it.
Sure. Our counties have been working very hard to make sure that we are having good communication. a lot of times, right, particularly our small counties, these are small teams that are both trying to help the outbreak and make sure that they are giving good guidance on infection control while also doing the reporting. We realize that's a challenge, and we're working with them now to figure out, is there more resources we can offer from the state level to make sure that they can meet all of the things we want to. We understand communication is very important so that we can respond, but I'd say that I'm been very pleased with our local public health partners and all that they've been responding to, not just in these outbreaks, but as we have thought about every single positive case that we have in North Carolina, our local health departments are following up with those folks specifically and making sure that we understand the case. It's how we get some of the additional data that we've been able to share with the public, both about their age, the gender, the race. Though that information is all collected from our public health department. So they have a tremendous amount of work on them, and it is Public Health Week, and so I do want to give them another shout out and thank you for all they're taking on. I know this is a lot, and every public health department has varying levels of numbers of people there. We're trying to do all we can at the state to support them. I just ask for a little bit of your patience as we mature what we're doing as we work through the COVID-19 processes. It's unbelievable to think we're only a few weeks into this pandemic because it is moving so fast, but do give us that patience as we work to continually improve and while we let our local health departments do the hard job that they have.
Thank you, Dr. Cohen. Next question, please.
This will be our final question. Elizabeth Ann Brown, Asheville Citizen-Times.
Hello, Governor and Dr. Cohen. This is regarding the new social distancing requirements in stores. This is kind of a three-pronger. Who will be enforcing the new social distancing requirements? Should people report stores that aren't following the mandated guidelines now to anyone? And what will the penalties be for violations?
So we have talked with the retail merchants about this and with heads of grocery stores. I'm pleased to tell you that a lot of them already understood this and have taken steps already to limit the number of people in their stores at a time. Of course, this can sometimes result in lines outside of the store, but having X's marked 6 feet apart to keep people socially distanced in line is important as well, and many of them are doing that. So I expect all of the retail stores that are open now to abide by this order, because we know that when people are bunched up together in a grocery store that virus can be transmitted potentially, and we want to reduce that. We also want to protect the store employees there with limiting the number of people at the store at a time. If the order is not obeyed, law enforcement has the authority to issue citations. The punishment is a Class 2 misdemeanor under the law. But we believe that our retail stores understand the importance of this and will abide by this rule. And we also want to encourage people to try to reduce the number of people in your family that actually go to the store. Only buy what you need. A lot of times people go and try to buy a lot and hoard something. The food supply chain is good right now, and we don't have a problem getting supplies to the stores. So we ask people to only buy what you need and to try to get in and get out as quickly as possible, particularly with these new rules in place. We hope everyone has a wonderful holiday weekend. Please stay home. Please continue to keep your physical distance. We're going to keep working to flatten this curve so our medical system is not overwhelmed. We're going to save lives, and we're going to get North Carolina's economy going as soon as we possibly can. Thank you so much.